Hello, dear students. Welcome to another important topic, that is acute otitis media. So, let's discuss this in brief. It can be defined as acute inflammation of mucoperiosteal lining of middle ear cleft. So, this is the classic definition of acute otitis media. Now, coming to the causes of infection. So, causes depends on the routes of infection. What are the most common routes? That is via eustachian tube. The predisposing factor can be patient is already a case of rhinosinusitis or nasopharyngitis, or patient is suffering from chronic adenoid or tonsil infection, or there is history of dirty water exposure in swimming pools. Also, there is another route of infection, that is via tympanic membrane through the accidental entry of water inside the ear. Coming to its prevalence, it is more common in children as compared to adults. It is more prevalent in lower socioeconomic groups. Allergy is also associated many a times with cases of acute otitis media. And why it is more common in children? Because children have short and straight eustachian tube as compared to adult. So that is why it is more common in children. And what are the infective organism that causes the acute otitis media? There are certain bacteria names are important, such as Streptococcus pneumoniae, Haemophilus influenzae, Moraxella catarrhalis, and Streptococcus pyogenes. Other than this, there are various viral infections also, such as respiratory syncytial virus and common cold infection. So that also many a times lead to the acute otitis media. Now coming to the stages of acute otitis media, first stage is stage of tubal occlusion, as it is clear from the name itself that there will be blockage of eustachian tube. So there will be edema and hyperemia of nasopharyngeal end of eustachian tube. Patient will present with hearing loss and otalgia, and there will not be any fever. This is important. And on clinical examination, tympanic membrane will be seen retracted along with the handle of malleus. Second stage is stage of pre-suppuration. There will be hyperemia of tympanic cavity lining will be present, and there will be marked otalgia to the patient, and patient also complains of hearing loss as well as tinnitus. So on clinical examination, in the stage of pre-suppuration, we will see the congestion of pars tensa, and there is another important sign, that is cartwheel appearance. It is also important, and many times it is asked in viva questions also. What is cartwheel appearance? So there is a leash of blood vessels seen along the handle of malleus, as we have seen previously in the carts where the wheels have been used. So there are spokes, many spokes centered around a hub. So that is known as cartwheel appearance. We will see further in the images. And next is the stage of suppuration. In this, patient will have excruciating ear pain. Patient will run with high grade of fever, and there will be red and bulging tympanic membrane on clinical examination that is seen engulfing the handle of malleus. Also, there is a yellowish tip visible as pus point. So this was all about the stage of suppuration. Here we can see in these two images. The first one is image depicting the cartwheel appearance. Here you can see there are a few spokes like representation, that is there are horizontal vertical spokes centered around the red congested handle of malleus. So that is appearance of typical cartwheel. And in the second stage there is a stage of suppuration. In this there we can see clearly bulging tympanic membrane that is highly congested, and there is accumulation of pus behind the tympanic membrane. So this is the stage of suppuration, and first one is the cartwheel appearance image. Now coming to the stage of resolution. In this there will be release of pus from the yellowish pus point, rupture, and symptoms will be subsided. Patient will get relief. What are the signs visible? There will be blood tinged discharge that later on becomes mucopurulent, and also there can be seen a small perforation in the anterior inferior quadrant. Now coming to the stage of complication, it is rare nowadays because acute otitis media is being diagnosed uh, very appropriately nowadays in antibiotic era, and there is good treatment available also for it. So why it occurs, the stage of complication? So sometimes it has been seen that when the patient is getting inadequate treatment, or there is highly virulent organism causing infection, in that case patient may land up into the complications such as acute mastocytitis or facial nerve paralysis. It is more common in infants, and there can also be labyrinthitis. So these are the few complications that can be seen in case of acute otitis media. Now coming to the treatment part, most important part of the treatment, that is medical management. Patients who are having high grade fever and severe ear pain, they will be given antibiotics such as amoxicillin, that the doses will be 40 mg per kg per day in 3 divided doses. We can also give ampicillin. The dose will be 50 mg per kg per day in divided doses. And, we can also give decongestant topical nasal drops, and we have to give analgesic and antipyretic to treat the severe ear pain and fever also. We can do ear cleaning. If patient is not relieved by the medical management, then we have to go for surgical treatment, that is myringotomy, that is incision over the bulging part of the tympanic membrane and drainage of pus. This will immediately relieve the symptoms of the patient, and patient will be given supportive treatment. So that was all about the acute otitis media. From exam point of view, it is a very important topic. Many a times short note or even a long question can also come in the exams. So keep learning, keep growing, and follow us for more such contents. Thank you.